I'm Kiera Morgan. Thanks for joining me on this episode of Coffee with Kiera. And today I am with Dr. Leslie Ogden, who is the CEO of Samaritan Hospital's North Lincoln Hospital in Lincoln City and Samaritan Pacific Communities Hospital in Newport. And we are sponsored by the Human Being in Newport and Lincoln City as well. Hi, Dr. Ogden.
Hello, Kiera. How are you?
Wonderful. It's so good to see you 6 feet apart, face to face.
Right, exactly.
So let's do some updates about Samaritan Hospital. It's been a while since we chatted.
It has. It's been really since before the pandemic started.
Yeah, I think the last time that we talked was actually just before the hospital, North Lincoln Hospital, was completely finished. You were right on the cusp of opening.
And we opened, and we were so excited. We opened the North Lincoln Hospital. Then a month later, we opened the remodeled portion of the Newport Hospital. And then what happened? A pandemic started.
Everything.
So everything happened. But we were so fortunate that we scooted in under the wire to make sure that we were ready to care for our communities here on the coast. That we have the new facilities. We had, of course, new surge plans that we worked on, and got everything tuned up before we ever saw our first COVID patients in our hospitals. So,
have you seen an increase in emergency room and hospitalizations with COVID and the new variant now?
With the new variant, we're starting to see this because we're sort of on that fourth surge where we're seeing infection rates increase across the nation. Certainly, we know where the hot spots are, but even in our own area where we're very well vaccinated, we still are seeing some uptick in the rates. And then, of course, correspondingly, we do see cases in our hospitals, both in the ER and admitted. The report I got from this last weekend is that they saw very much so an increase in positive COVID testing out of the ER, but the vast majority of those people then were discharged home because they were healthy enough to stay out of the hospital. But with each of the surges that have come, the first one we saw last summer, the second one we saw, at the beginning of the summer, the second one we saw around that August, September timeframe. The third one we saw at the end of November, going to December and January, and now we're seeing this fourth one. Every single time we see those uptick in positive cases, uptick in infection rates that our county, publishes, and we can follow along, and then correspondingly, not an unmanageable number within our hospitals, but certainly, very real needs.
And the hospital has also been working really hard to be able to communicate with those in our area that may not speak English, right?
Right. And that's a big area of outreach is trying to figure out how do we spend extra time trying to make sure that we are covering everybody who may not always seek our care in traditional manners and may not have a primary care provider, may not, sort of have be in a traditional care network. But how do we make sure that they have all the information that they need and that they get opportunities to get this vaccination? And so, you see us show up at different times in different places. Again, always relying on the partnership with the county, with the OSU Extension, and some of the folks who've done some amazing interpretation, services with us, just to make sure that we're getting to the right people at the right time.
And let's talk a little bit about here's Samaritan North Lincoln Hospital. How are things going over the last year with the new hospital?
Oh, wonderful. It's so nice to be in our lovely new surroundings. The only real challenge we've had is to try to figure out how to sort of distance people in an area. We consolidated all of our outpatient services, and we had this fantastic idea to sort of bring everybody right into the front door of the hospital, have them get their outpatient services in what we call flex rooms. They can be anything for anybody. So if you needed a lab service, you would come in one door, the phlebotomist or whoever else you need comes in the opposite door, you meet in the middle, and you have your service. And that was just a lovely idea until COVID hit, and we needed to space people out in waiting rooms, and we needed to make sure that we just didn't have a concentration of people. So we have moved the outpatient lab to one of our outbuildings, and most of the people who've had to use the lab within the last year have figured all this out, and it's a little bit sad that we haven't been able to use our facilities exactly as they were designed, but we'll get back to it, eventually. It's just we've got to do the safest thing for people in the time of the pandemic. But other than that, we've been using our hospital maximally. We have seen, upticks in surgeries, where a lot of people coming to us for general surgery needs, for orthopedic needs. Orthopedics has grown quite a bit, and we're just so excited because it's in pristine, brand new, beautiful, cutting edge surroundings, and our building has performed very, very well for us.
That's fantastic. And Samaritan Pacific Communities Hospital has grown as well, right?
Oh my goodness, yes, it is growing even more. We have had just amazing support from the community because taxpayers really paid for that hospital, and to have that commitment to start, and then I'm hoping, and the people I've talked to have said this, that they never expected just quite that hospital, and that it is spectacular. It is amazing, and it has served us again so well already. And so we have been able to grow within it and grow services. We now do more infusion services than ever before. We have more surgeries than ever before. We have already grown into a fourth OR that we didn't think we would use for a long time.
Wow.
Already grown into that with, again, general surgery and orthopedics there leading the way as well. We have filled up our ER, of course, as most people know, on both ends. This is the time. This is the time of year when we get influxes of visitors, and that is holding true this year. And then even on our inpatient side of things, we've seen an uptick in occupancy, and just have a more steady occupancy, over time. So lots of good growth.
And you still have the Walkin Clinic. As a matter of fact, in Newport,
it's going to get a new home.
Getting a new home, yes.
Yes, absolutely. So for anybody who's familiar with the temporary modular building that has had two homes, in the back of the hospital and now in the front of the hospital, it has served us so well, and we're so glad we made that purchase. But they really need a permanent home, and the city has been very flexible in allowing us to continue to use that modular building while we're remodeling. For those of you who remember way back when, the Apple Peddler building that sat on the corner of Abbey and Highway 101, and has since been a financial services building for us, and has housed Samaritan medical equipment. Now it is, if you haven't seen it, has a fence all the way around it, and it's been gutted and rebuilt as a clinic. And that has taken some interesting construction feats, because essentially it was never built to house so many plumbing needs and water needs and stuff in each room. So we've really had to do some work on the foundation to bring it up to the point that it can be a clinic. but it will be finished soon. We anticipate by the end of the year we'll be in that and serving Newport in all new ways, because it too will be bigger than it has been in the past, and we'll have both occupational medicine services there as well as walk-in clinic services.
Now, speaking of walk-in clinics, you have one in Lincoln City also.
We do.
Are those the only two?
Correct. Those are the only two that Samaritan has.
But there are other clinics that you have in other smaller communities in Lincoln County, such as Depot Bay, Toledo, Walport, and do you
Right.
have some stuff in Yachats also?
Not in Yachats, although that is on the strategic plan for the future. I would
Ooh.
love to see us, able to provide services really across our county and not have any pockets, that are really left out. But yes, you have named all the places. So we have 6 clinics, primary care clinics, that serve everywhere from Lincoln City down to Walport. And we have 2 in Lincoln City, one by the hospital, and again, one on Highway 101. We have one in Depot Bay, one in Toledo, one in Walport. Of course, the clinic that is in the hospital in Newport. And between all of those primary care clinics, we're hoping that we're covering most of the people who need our services, but we have a renewed commitment, and we have been doing some extra hiring so that we understand we're still in a health profession shortage area. We're still classified as that, so we haven't reached the goal yet of really taking care of everybody as much as we can. So you will see increased hiring especially in family medicine and in pediatrics, over the next 6 months or so.
And speaking of which, you're being
Mhm.
kind of proactive where that's concerned. Some exciting news to share about Samaritan and growing your own physicians.
Absolutely. We are entering a whole new age because a couple of years ago we applied for a grant from HRSA, from the federal government, as well as a state workforce grant, and we were able to cobble together enough money, and it takes a lot. This was to the tune of $1.25 million to go towards starting our own family medicine residency training program. And it's called a rural training tract because we are one of 2 rural family medicine programs that were started at the same time a couple of years ago.
Mm-hmm.
We've been working on what that curriculum looks like, working on hiring a program director, and we have him hired, and he will start with us on site in Newport January 1st. We've been working on hiring additional family medicine physicians who not only will serve our community, but also will act as faculty for this program. And in May of 2021, just a few short months ago, we were awarded our accreditation for this rural training tract family medicine program, and we are official as of the beginning of May. So this summer we are interviewing residents. Again, only those who are interested in family medicine and only those who are interested in training in a rural program. And we hope to have those people selected to start next year. When they start, they'll spend their first year in urban programs, getting a lot of volume and learning things that they may not be able to learn in a rural setting. But then the last 2 years of their training, and it's a 3-year total training program, the last 2 of their years will be spent entirely in Lincoln County.
That's great.
And so we will have them with us, and we'll be able to train them in sort of idealized practice of rural family medicine. The other interesting thing that many people may not know, and they may ask, like, why are you doing this? Not just to cause us more angst and to figure this out. But we really are seeing our future with a shortage of physicians nationwide, and we want to make sure that we don't fall short in Lincoln County. But number two, we know that the majority of residents who train in an area tend to stay in that area. And so we're going at it a couple of different ways. We want to, of course, see the people that we train stay with us, and we know that that is statistically correct. But we also want to train them in how to be an idealized rural practitioner, because it is different, the practice of rural medicine versus urban medicine. When you don't have specialists all around you, when you do have to have a depth and breadth of skill set, and you become so much more to your patient. You become their sometimes single source of medical care, and so it's important that we are training our physicians to give that level of care in our rural areas that we need them to have.
Has hiring been as tough for you here at the hospitals as it has been everywhere else in Lincoln County?
Yes, unfortunately, it very much has. We have areas that are more impacted than some more than others, um, uh, for a number of reasons. I think the pandemic, of course, caused a lot of people to make changes that they may not have made, especially in healthcare. So we saw people who maybe were headed for retirement sometime in the future decide to take early retirement. Some people left healthcare workforce completely, and then others had to jockey around to get childcare issues taken care of with all the school changes. We had people who were both immunocompromised or had someone immunocompromised in their family that had to figure out how to juggle all of that. And basically all of these issues sort of stir them up. That did create some problems and some issues, especially in rural environments where we have a typically older workforce. So more of that sort of impact, and then a little bit harder to attract people to replace this workforce. And so we have run into some staffing issues. We know that our nationwide training programs for nurses and doctors, and even some areas like medical assistants, just aren't enough to generate the level of replacements that we're needing because of the pandemic, because of retirements, because and so it sort of creates a cycle here. And then when you throw in additional challenges Lincoln County has, like lack of and expensive housing, when you throw in minimum wage changes that have changed this summer, so even some of our entry-level jobs, we knew that minimum wage was changing across Oregon, but we thought it was changing in those urban environments first, in the counties around the metro area, and that we would have years to get up to that level. And what we found was that some of the chain national sort of employers are already meeting that. So all of a sudden, local businesses and those who are just sitting in Lincoln County are finding that we are not as competitive as we thought we are. All of a sudden, in one day's time, it really changed significantly. So we're having to go back to the drawing board and trying to figure out, okay, we thought we had years to make some of these changes. How do we become an employer of choice once again? How do we become savvy through negotiating all of these changes? And how do we make sure that we have the staff to continue to serve our communities? So it's not any lack of challenges, but we feel like with partnerships like with OCCC to
Mhm.
build our own nurses, to build our own MAs with this family medicine residency that we're starting. That and just trying to figure out some unique ways to be a preferred employer, we'll be able to get through this. And we're taking so many. I just sent out a message this morning to our employees and said, guys, if you've got any great ideas, about everything from employee retention to attracting new people to even how does it solve some of our supply chain issues, because now we're seeing issues regarding computer chips that are not available, and we can't even buy new computers, and that's a huge impact to almost every industry, but particularly healthcare, because we can't expand and we can't do more if we don't have the computers to do that. So many different things impacting us along the way. But again, that's why we're here in leadership, to try to figure all this out and work with our staffs and become a better and better organization.
You're amazing. Thank you. Anything you want to add as we wrap up?
I just am flabbergasted sometimes that we're still in this pandemic, that we still have all of these challenges, but we continue to figure out ways to grow, ways to better serve our communities, and I marvel at the teams I've got working with me. I'm a lucky person, and I think Lincoln County has a very bright future as far as its medical establishments.
Well, thank you, Dr. Ogden, for joining me on this episode of Coffee with Kiera, sponsored by The Human Being in Newport and Lincoln City. In Newport, located at 6th Street and Highway 101, and in Lincoln City at the north end of Highway 101 on the west side of the highway near TLC Credit Union. For Oregon Coast Breaking News, I'm Kiera Morgan.